been known for decades that inflammatory mechanisms play a central role in certain acute cardiovascular diseases, such as myocardial infarction. However, it is less known whether inflammation is also important in chronic cardiovascular conditions. After a myocardial infarction, a large number of immune cells invade the damaged myocardial tissue, and these cells on one hand contribute to myocardial damage, but on the other hand they also initiate regenerative and adaptive processes. In the recent years, biological therapies became available to reduce the number of immune cells or to neutralize certain inflammatory mediators. Results with these biological therapies on the cardiovascular field have shown that inflammation indeed is a very important therapeutic target. However, it is not known still whether it is true also in chronic cardiovascular conditions as well. The aim of our research group is to study the link between inflammation and chronic cardiovascular diseases. Our focus is to study heart failure. Heart failure is the end stage of many cardiovascular diseases, and it often develops after myocardial infarction. The mortality of heart failure is comparable to the most common forms of cancers, and it is quite shocking that 50% of the patients diagnosed with heart failure die within 5 years of the diagnosis. To study heart failure and the link between inflammation and heart failure, we use human tissues and small and large animal models. Heart failure often develops after myocardial infarction. However, there are certain patients who also have myocardial dysfunction and heart failure without having a prior infarction. These patients often have obesity, diabetes, high cholesterol level, or even hepatitis and cirrhosis of the liver as a result of obesity. A special group of patients showing the symptoms of heart failure are those who have undergone cancer chemotherapy, and they develop heart failure as a side effect of chemotherapy. In addition to examining all these conditions, we place a special focus studying the role of aging in all these diseases. As it is well known, elderly people often present with a more severe form of cardiovascular and respiratory diseases. Therefore, we use not only young animal models, but also older animals to better model the human condition.